COVID-19 has impacted all of us, but people who are incarcerated are experiencing a dramatic change in their living conditions and safety during this pandemic. Prisons and jails are hotspots of COVID-19 in the United States. The fact is, if you're living in prison during this pandemic, you're at a higher risk of getting COVID-19. Life in prison is group living. You have meals and recreation together and share common areas. You are unable to socially distance on your housing block or in your cell. You may live in an open dorm. Staying 6 feet apart is often impossible. Dozens of people enter and leave prison every day, increasing the chance that you will come in contact with someone who's been exposed.
One of my major concerns is being in the day room. The day room is just a room with bars in it. There's no windows, there's no doors to protect us from people that are coming into the prison. If someone walks into this prison with COVID-19, they will have to walk past us. And if they were to cough or sneeze or anything like that, it would literally be affecting the whole entire room.
Welcome to a special edition of Heart City TV. My name is Malik Boyd. I am honored to be here with you tonight to talk about such a very important topic. COVID-19 has affected all of us around the world. Definitely here in the United States, we have been impacted. While much of this conversation has happened and has been focused around communities, streets, neighborhoods, cities, one of the major issues that we have not focused on is all of our family who have been incarcerated. Those family members are impacted by COVID equally the same, and in some cases, it has been a little bit more impactful than what has occurred for all of us who are living day to day within our cities. And so it is crucial that we have this conversation, that we begin to break down the myth, the stereotypes, and really get down to the real facts, and more importantly, solutions that can ensure that those we love who are incarcerated and serving time will have all of the resources that they need to remain COVID-free and to deal with this pandemic as we do on the outside. And so for those who are also joining us to talk about the vaccine, I want to be clear, we brought together very impactful, very passionate medical professionals who will not sugarcoat anything as it relates to what's happening in our incarcerated community, but then also for you who are questioning the vaccine, you have ideas around what it is and what it is not. We're going to dispel all of those myths and stereotypes and get right to the facts of the vaccine as well, because it's crucial now more than ever that we have facts within our community, especially as we talk about our health. I want to talk about some other facts for us to know. Here are the federal facts on this issue. Today, the Federal Bureau of Prison has 123,119 federal inmates in their managed institutions and 13,882 in community-based facilities. The staff complement is approximately 36,000. There are 6,176 federal inmates and 2,019 Bureau of Prison staff who have confirmed positive test results for COVID-19 nationwide. Let's talk about PA. And PA, based on the Department of Corrections website with data from their department's COVID-19 portal, as of today, 2,242 active inmates and 311 active staff have confirmed positive test results for COVID. Those are the facts. And so as we discuss these issues, I wanted you to know the numbers, where they stand today, and more importantly, how can we get those numbers down and ensure that we have zero cases, not just on the outside, but for those that we love. For those who saw the intro of this special, know that that was a portion of an incredible project, an animated video that was brought to you by the Pennsylvania Institutional Law Project. You'll hear from their executive director, Ming, and Chester Hollman III, who was not only just a legal assistant, but also the film narrator. And so that was his voice, who began to tell you the story of what's happening inside. Now, Chester was formerly incarcerated and exonerated after serving 28 years in prison. His story is not only an impactful one, but his work in advocacy for the incarcerated community truly knows no bounds. And so, without further ado, I want to welcome Chester Hollman III. It is an honor having you with us today. Welcome home to Heart City. This is an amazing topic, and I'm thankful for the work that you are doing to make sure that we're dealing with this in the proper way.
Definitely. Thank you for having me.
No, it's our pleasure. And so, Chester, for those of us who don't know, those of us who do not have family members incarcerated and have not seen the inside of the walls, talk to us about what's happening in the space. Let's begin to take some of the myth and stereotypes of the narrative, but really hear from you, one who has advocated for the community. What's happening inside the walls as it relates to COVID?
Well, I mean, I still talk to a lot of guys still incarcerated, and I get phone calls, and a lot of guys in there are just scared. Life in prison is it's about moving around, whether you're going to programs, yard working out, it's everything to keep your mind stable and your body fit. And with COVID, since COVID-19, it's on a 23-hour lockdown, so these guys are restricted to cells, and not getting much information on COVID-19. All they know it's a death sentence if you get it, potential death sentence if you get it. So there's a lot of fear, a lot of concern, and there's also a lot of hopelessness, I guess you would say, as far as the Department of Corrections actually doing anything to help prevent COVID-19 reaching their cells, so to speak. Just in prison, the main thing in prison, which keeps, I think, prison stable, is hope. However guys find it in there, it's hope. And, I think once you lose hope, it becomes a panic, and I think it welcomes other things in. So, I tell these guys all the time, there's medication and there's the vaccine out there now, but at the same time, you have to have a fighting spirit, and, if these guys are losing that, I think that if they are in turn infected with COVID-19, I think it can be, potentially deadly for them, opposed to someone with a fighting spirit and has that hopefulness, potentially fight it a little bit stronger than someone without hope. You know what I'm saying? So. Well, let me in regards to the video for COVID-19 that the Pennsylvania Institutional Law Project put together. The whole idea was to just bring awareness about COVID-19 and how it affects the incarcerated. It's a topic that we feel strongly about, and it's a big part of the work that we do at the Institutional Law Project. It's fighting for not only the constitutional rights, but for the humanity of those incarcerated.
Yeah,
Welcome back.
Listen, this is a world of Zoom and everything else, right? And it's great that we're having these kind of challenges because I want people to know how committed we are to this and making sure that we really have these kind of conversations, even in the world of new technology as it stands. And so, Chester, where are the issues? Like, what's happening? Is it a scenario where it's inadequate care? Is it a scenario where it's exposure from guards or individuals who are coming through and visiting? Because to actually get lost in solitary confinement, which to my knowledge is what's happening, no, I didn't do anything wrong. I'm following the rules. I'm doing everything I'm supposed to do, but literally I'm going to have to spend 23 hours in solitary just to make sure that I don't catch COVID. Is a little bit extreme, by anyone's standards. And so, has there really been a idea of where this is coming from? Any kind of stats that are indicating the source?
Not that I'm aware of, but I mean, I can only say that, if the guys are in prison, I would assume guys that are coming to the institutions, fresh off the streets, there's potential there. But for the most part, we would have to assume that it's the staff. And, I think it has to start there, with the daily checks. Mm-hmm. From what I've gathered, I understand is that the staff, their temperatures are taken when they come in. But if you're asymptomatic, naturally, and for somebody walking past somebody who's potentially underlying condition, it's going to affect them. So I think it has to start at the front gate. When the staff coming in, I think staff has to be more responsible. Mm-hmm. Those who know they have symptoms and still coming to work. I mean, these guys aren't running around in the communities and then bringing it back. They're there, right? So it has to start at the front gate, and I think it just has to be more accountability for the staff that's coming in daily, and and once it's in there, it's just like it spreads like wildfire. These guys are in such a close proximity. Even though jails are on lockdown, these guys are still coming out for that 1 hour. It only takes 3 seconds to breathe on someone and take it back to your cell, and it's just like that. So I just think that it has to begin with the staff at the front gate. And as far as the medical care, long before COVID-19 came about, I mean, medical care in prison, each doctor and nurse are naturally qualified to hold the jobs. However, due to budgets, each department has a budget, and they try to stay within that budget. So, I hate to say it like this, but they do just enough to keep you alive. Everything in there is, you receive Motrin, Tylenol, whatever your aches and pains, it's going to be Motrin and Tylenol.
And these are in the adult facilities.
Yes. Well, now with COVID-19, I got released 7 months before COVID-19 hit, so I was very fortunate. But prior to that, like I said, the medical department is very standard. Like I said, you go up there for, I don't care what you go up there for. The first diagnosis is Tylenol, Motrin, and then they ask you to come back. You got to keep going back to, for the more serious ailments that you might have, and it's a situation that you hate to see people in. I understand it, for those who've committed crimes, and this is our way of punishing, so to speak, by incarcerating. And then, but at the same time, these are still human beings that we have to treat humanely. And
so you bring up a interesting point, because you use the term punishing individuals, and really our system should be focused on rehabilitation.
That's what it's supposed to be, but these are not. Like I said, I did 28 years, and in my 28 years, unless I chose to rehabilitate my, change myself. There's really not a whole lot of real, but it's more of a warehouse. Because I had a life sentence. Those guys with the longer term sentences, you really don't. You're not really afforded the opportunities. Let's say somebody with a 1 year sentence, because they feel as though you're doomed to die in here. So therefore, you're kind of put on the back burner and left to die, more or less. And so there's not really a lot of things in there as far as rehabilitation. So I would call it more along the lines of punishment.
So I hate to say it this way, but it reminds me of a scenario back in the day. We used to make a joke in our community, in our barbershop, where there was a brand X version of Robitussin called Tussin. Right. And as far as we knew, grandma was going to give us Tussin for everything, right? Your knee hurt, put some Tussin on it, get outside. And so it sounds like, unfortunately, that there's this blanket one size fits all approach to just dealing with medical care.
Yes.
At least from the perspective of those who are sitting and going through this experience. And so PPE, we had major conversations about PPE within the community. In fact, there were fights, whether or not somebody would go to a store, a security guard says, hey, you can't come in without a mask. And literally it led to shootings and really silly responses. What's happening inside of our system as it relates to PPE for inmates, not just individuals who are serving as correctional officers and the like?
Well, like I said, I've been home for over a year now. So like I said, I can get my information from the guys I speak to. And I can speak to, and as far as when I was in there, the things that we're allowed to clean ourselves, like you clean yourself once a week. Now that's first and foremost. You clean. You get 15 minutes after 7 days. After 7 days, you get 15 minutes to clean your cell, and you're given a very little bit of, chemicals, which is watered down to clean the cells. So at this stage with COVID-19, I don't know if it's increased. I know they received 2 masks, and I'm not sure about the gloves, but you get 2 masks. That's got to last you. You got to wear these masks over and over. So,
now, are these fabric masks or?
No, they're not the fabric mask, but the other mask.
The N95s.
Right. Not that. We ain't getting N95s. No, but the medical mask.
Wow.
Yeah, that's what they're getting. So you get 2 masks, and that's supposed to last you, And I've been told that the guards come in there. That's another thing. That the staff come in, they got their masks down by their chins, and some of them don't wear a mask. I mean, there's no accountability for the staff. I hate to put it on that, on them like that, but it has to start there. It has to start there. I believe that it has to start there. They have to be held accountable.
It's unfortunate to even hear that this is a norm for anyone, let alone those who sometimes have very little in terms of resource to be able to do anything about it. The PA Institutional Law Project, you're doing amazing work. It's obviously a legal aid organization that's advancing this civil rights issue. What is it in the space right now for those who are just hearing about it for the first time? From your perspective, what does the organization do? How can one who's listening right now get active and engaged, especially those who have loved ones inside of our institutional systems?
Well, I think for the most part, like the Institutional Law Project, like I said earlier, they fight for the rights of those incarcerated. Whether it's and just like as far as being treated humanely, as far as people getting involved. I mean, starting here with listening and watching this video that's been made, the COVID-19 in prison. I haven't remembered the project that long. I've been there I've been home a year, and I've been there maybe a little less than a year. But in the time that I've been there, I've just been fascinated by the work that these people do. It's just fascinating. I mean, they're passionate about the work and representing inmates, and making sure they're treated fairly, humanely, treated like people. And it's funny. Many years ago when I was incarcerated, I actually wrote seeking help from the Pennsylvania Institutional Law Project.
Wow.
So to now find myself working there, I just feel very honored to be there and be a part of this. And like I said, the the fight for the guys that I left behind, so to speak. And, you know, especially during a time like this where, you know, guys are like looking for hope. And, you know, they reach out to us with different issues, and we try to respond. And if there's litigation is possible, you know, we take these cases to court and they litigate these cases, and just fighting for fairness, you know, for these guys and women.
I think you've done the organization a great deal of justice in that introduction. I want to bring Ming, who is the executive director of the Law Project, to this conversation. Ming, it is an absolute honor having you with us today. Thank you for joining. Let's see if we can get her in. Can you hear us?
Yes, I can hear you. Can you hear me?
We got you loud and clear.
There we go, man.
It's Friday night technology. That's how it
Everyone's
works.
using the internet, right?
Yeah, it's all good. Thank you so much for joining us. I know everybody's coming in from all different places, and so we honor your time and willingness to talk about this. The organization, you're dealing with a gargantuan task here, because it's not just COVID-19, but from everything that Chester is talking about, the actual care, quality medical care that needs to happen for our family members who are incarcerated. Talk about this project, its importance, and where it stands right now in terms of getting results.
Sure. So we launched into action, trying to make sure that everyone would be protected from COVID-19 and the effects would be mitigated. So back in March, we, along with 2 other organizations, sent a letter to every single state, Pennsylvania, urging them to use science-based things. People need access to soap, sanitation things, masks, social distancing. Those are also, and you might remember in the beginning, even on the outside, and we told them incarcerated people need to have masks, but staff need to have masks and they need to wear them. Testing is important. Early on, prisons were very stingy about tests. And we said, you have to test people if they have any symptom, not just a fever. So we had dialogues with multiple prisons through that process. Some, I think, were receptive and some perhaps less so. It's really vitally important that everyone, different ways. Some prisons resorted to this very intense use of lockdown conditions, which is essentially using solitary confinement to try to address COVID-19. We disagree with that method because that's physical and mental health, just as Chester had said earlier. Now, some prisons do that because there are different structures. Some people live in cells, but there are also dorm situations, so it's very difficult to socially distance. As we have now learned, COVID-19 also passed through aerosol particles. So living in a dorm, it's going to spread very quickly. So as recently, 85% of COVID-19, they should have been doing like that. So I'm sure across the state about, we have to get people across the state that people are now in very so it's like experts, And there are ways to, maybe you don't have the same movement that you did before, but you can come out suicide from someone who, you know, we don't know exactly what happened, but I personally would not be surprised if being in a cell almost 24 hours a day for weeks on end. Our goal with this project is to, with the film project, was to educate how people are suffering under these conditions and aim for better conditions for everyone. And urge the prison to take all proper precautions. And I'll note that, you know, what we did was we sent a letter. We've been writing advocacy letters. I think in total we've written at least 20 advocacy happened because COVID-19 there were challenges, systems to, you know, letters to prisons, and then we've also filed 2 class action lawsuits. One against Allegheny County Jail, which is the Pittsburgh jail. And one against the Philadelphia Department of Prisons.
Yeah. So I'll tell you,
we will address these issues on different levels, whether it's. Can you hear me still?
We can hear you a little bit. I get that this topic is it's tough enough for technology to not want us to have this and to bring so many of your bright minds together on this. So I heard that there's 2 class action lawsuits that you are currently in the space with and dealing with. And Chester, let me ask you, this essentially is unconstitutional in some regards, or is it not? I mean, yes, I get it. I'm incarcerated. I'm already behind 4 walls. I'm already behind barbed wire. I'm already behind, fencing and security.
Right.
But if I'm complying with the rules, solitary confinement was used as a correctional measure.
Yes.
If I was out of pocket, right?
Right.
To be used in this way as a quick fix, which really may not even serve as a fix for COVID, I believe it's definitely infringing upon civil rights and bordering a unconstitutional approach. From an advocate perspective, what has been the general consensus with the community when they hear these kind of conditions and tactics being used?
Well, first and foremost, I believe that I would construe it as unconstitutional. However, that's an argument for Ming to make it within the courts, within the litigation. I would think that there has to be, I guess, better knowledge passed on to the inmates. I don't know necessarily what you can do. I mean, like, you're so confined. You know what I mean? So as far as like coming up with a plan, that I don't know. But like I said, I know that 23 hours in a cell, like you just said, and you're complying with all the rules, you're doing everything you're supposed to do. You got to save your time waiting to go home. And not only that, there's a lot of guys that are coming out every day. These guys are coming out, in the streets every day. So we don't know if we're coming COVID-19 and bringing it into our communities or not. So therefore, I don't know what they're doing necessarily to combat the problem. I think putting a person in a cell and saying you get 1 hour a day, that's I think going to fix the problem or at least address it. I guess we're trying to come up with ways, I guess, to Ming has formulated, like I said, litigation with this, and she has different ideas that they've proposed will help combat this. But at the same time, my whole thing has always been from the inmate perspective, and I believe that fear. I think fear can also bring things on, negative energy, so to speak. And these things aren't addressed. And like I said, these guys are made to feel, like there's hope. Like they're being protected. Like they're gonna. Like a lot of guys fear. They feel if you get COVID-19, it's over for them. Because like I said, the inadequate medical care, And we see prior to COVID-19 how medical was. So now something like this, a pandemic, these guys they're feared for their lives. And there's talk of a vaccine. There's talk within the community side that they're fearing the vaccine because they don't know if they're actually going to get the proper vaccine. So it's fear. And I think that has to be addressed as far as like just giving them information, keeping them informed. I guess they get a lot of information from CNN and news opposed to directly from the prison staff itself.
So I look at our comments today. Elaine Salon says the Marshall Project is doing a great job capturing the data nationwide. We agree. There's, quite frankly, some very direct conversation. Lavette Henderson said, look, we need a responsible secretary. If we had a responsible secretary, we wouldn't have to advocate for our loved ones. And that's a big issue because we have to talk about electeds and those who have been appointed to serve, where they stand and what's occurring in the space as well. There's also love in the room. Susan Apatal says the PA Institutional Law Project is doing incredibly impressive and important work. Thank you, Su Ming, for your initiatives on behalf of incarcerated people. So Sue, what can we do for those who are hearing this story, understand it for the first time, or going through it and experiencing it with a loved one who is incarcerated? What's our next step to ensure that COVID-19 protections are properly put in place and that we're advocating for quality medical care beyond this moment, beyond this pandemic?
So I apologize, I cut out a little bit. Can you hear me?
We can hear you.
Okay. The first thing is education. Watching this, learning more about it is incredibly important. Getting real information about what it's like for people is incredibly important, whether it's contacting your elected official, your advocacy to the prison officials themselves, and of course, staying in touch with us. We always appreciate it. Follow us on social media, Facebook, Twitter, Instagram. All of that is incredibly important. If you have a loved one, you can contact us or they can contact us directly. And of course, last, if you want to support us financially, the reality is litigation costs a lot of money.
Yeah.
And that's some things you can do from the small, just learning more about the issue and then, doing whatever advocacy you feel comfortable with. But we urge you, that can be really important. Not just our voices, prisons that they need to provide all that. Don't use solitary confinement or lockdowns to address the issue, treat people humanely, and then stay in touch with us through our different means. You can join our listserv,
Yeah.
So I don't know. Can you still hear me?
We hear you. You're going in and out, but I will try to reiterate for our broadcast audience what you said. Obviously, support in any way volunteer hours. Chester, I'm sure you can help guide us through on those volunteer hours and things that need to happen, and letter writing campaigns to electeds and those who have or consider stakeholders in this issue, right? And then also, having conversation with the medical community. How can we provide support for what's happening as well? The other component that broadcast audience that Su Ming talked about is, quite frankly, the resources needed to keep the fight. Su Ming has dealt with tons of cases at Supreme Court level in the circuit courts, and it's really important to make sure that we have the resources to address these issues, especially when we talk about long legal battles. The amount of research and preparation to go into those requires those efforts. And so we will make sure that we promote that. And then also this animated video, which my hat off to your whole team who's engaged in this video. I think it's really important that we utilize these new technologies. Obviously, animation plays a major role now when we can't always capture film the way we want to. I think you guys did an incredible job in telling the story and providing the facts in a way that we can easily digest it. But I think more importantly, we need to make sure that we're sharing that video, and we'll have it on our social media, and we'll also promote it throughout the next couple of weeks to make sure that we have mass saturation of this message within our community. Chester, those who are in the chat, they're saying, look, I want to know if we can donate supplies to the program as well. On behalf of the organization, can you talk about how they can contact the Law Project and get information or resources to Su Ming and the crew?
I believe you can go on to the website. Things on Facebook, I believe, as well. We have Facebook, and contact things will be conducted that way, I believe.
Okay, and so we'll make sure that we post those tonight, so those who are asking those questions can make sure that they get involved and advocate for those that we love in the space. Su Ming, thank you for your leadership. It is needed and quite crucial at a time like this. Advocating for those who cannot advocate for themselves is so important right now. And so we honor you and appreciate you.
Thank you so much for having me.
Absolutely. And we're going to keep pushing this animated video that Chester Hollman III narrated. We honor you and appreciate you for your work. Your story is a very unique one, and it's well,
thank you. I actually have to
go ahead, Sue.
To also just thank, yeah, can you hear me? I wanted to thank the incarcerated people who spoke to us, who are featured to speak about what they experienced. So in particular, I wanted to thank them. We kept their names anonymous for their safety and privacy, but I truly want to thank them as well as the family member who really spoke from their heart about at the Pennsylvania Institutional Law Project and our partners on the project.
I think you're spot on, and please charge that to my head and not my heart. Truly, those inmates who shared their stories is quite crucial, because without the stories, you would never know what's happening in the space. And so we honor them as well. Chester, thank you again for all that you do. We honor you and the team over at the Institutional Law Project. And so we'll continue to post this throughout this broadcast. We want to make sure that people get a chance to see this video, download it in your favorites. It's only 15 minutes. And so take time out tonight throughout the weekend to watch it, understand what's happening, and share. Chester and Sue, thank you so much for joining us today.
Thank you. Thank you for having us.
Thank you. So you've heard from Su Ming, you've heard from Chester about what's happening in the space. This is not a easy topic to discuss, but a necessary one. The treatment of individuals who are incarcerated is so important, especially because they cannot advocate for themselves. They need to really be heard, and they need for their voices not to be muted or to be translated in anything other than the message that they are delivering. Tonight, we are finding out that there is more to be done behind the walls for those that we love. I also want to bring in those who are in the medical profession, who are doing the great work of whether it be therapy or serving as medical doctors themselves. Dr. Keli Drew Lockhart, she's a doctor of psychology. She is a New Jersey licensed professional counselor, New York mental health professional counselor as well. Her organization, the Therapeutic Wellness Center, Healing Through Psychotherapy. She's currently a mental health clinician in the juvenile prison system in New Jersey as well, with well over 19 years working in mental health care and medical care for our juveniles who are incarcerated. I want to bring her into this conversation. Dr.
Good evening.
Good evening. It is great to have you with us tonight. Thank you for joining.
Thank you. Thank you for having me.
So,
it's a pleasure to be here.
It's a pleasure to have you. Doc, you've heard, some pretty interesting stories.
Yes.
There are those who are going through some tremendous challenges, 23-hour lockdowns. Let's be honest, half of us could not handle 3 hours with sometimes our own family members when COVID lockdown hit, but yet we're almost forcing, really, and essentially we are forcing individuals who may have done nothing wrong to now be totally locked into confinement as we deal with this pandemic.
Right.
It's creating a tremendous mental challenge, as I'm sure you know. And so our adult facilities are going through some tremendous challenges and are in need of change. What's happening where you serve in New Jersey as we talk about juveniles? Because I think that's an equally crucial space, and honestly, one that's equally as important. These are formative minds. These
Yes.
are individuals who can be truly impacted by things like solitary confinement. So are you seeing those kind of cases there? What is the landscape as you know?
No, our landscape, I'm happy to say, is quite different. While I have worked in DOC New Jersey, I'm not there now, so I really won't speak on that. I know we sort of overlap with our protocol, but again, I'll speak directly to the juveniles. And I think that our teams have been doing a great job at managing, I call it the RoRo, so managing the RoRo virus, and making sure that our boys and our staff are kept safe. We have protocols in place. Their temperatures are taken in the morning and in the evening. If someone is positive, yes, they are separated, because if we're positive at home, we ourselves have to be separated. Now, yeah, we're quarantined in our home. It's a different environment, but it's still about safety. So they're separated. If they're in contact with the staff who tested positive, and even if they're negative, they're separated off of their unit so that they can, again, be kept safe. Same CDC requirements we follow. It's 14 days. Ourselves as staff, to make sure our boys, our young men are safe, we get our temperature taken every day. When we come in, we have bands to wear to make sure everyone knows that you are following protocol. Your temperature was taken. We're doing the saliva test. The boys actually come up again. I think it's like every 3 to 4 weeks. They're done, and then it's mandatory for staff who are working on grounds to get their saliva testing done. We use the saliva kits, and we actually, mental health and medical, actually pass out and administer those saliva tests. So I know I get mine done every round we go, and I make sure that the staff who are listed are getting theirs done as well. So I feel like we're doing a good job. Are there positive cases? Of course, it's a pandemic, but we haven't had any. We've had juveniles who may have had a positive test, but no symptoms, and that's happened too. So if you ask one of the boys, they probably say they're locked down for 50 days, and because that's what they're going to say. So I don't know how different it is in Pennsylvania, but I know that we really take their safety to heart, and our safety, because again, like as Chester said, if one of them gets sick, yes, it is because staff is bringing it in. And that's why we want to make sure we're done. One thing I would have reversed, I would have had all the staff tested before having the juveniles tested. Okay. In the beginning of this, I'm like, why are you testing them before us? We're the ones bringing it in. But as a whole, we're all getting tested now. Yeah. And that's what's most important. I think they're doing a great job.
It's good to hear that kind of course correction happening, because I think in many spaces, whether it be the business community or the like, some of it was knee-jerk reaction. You know, we were jumping to what we believe were solutions or ways to at least have front-facing action, but not always being the most effective. To your point, why are we testing the children when we're the ones who are potentially carrying in? And so it's good to hear that there's an ability to turn the ship there, and it's happening. Let's talk about mental health. You know, mental health, especially in communities of color, is one thing. We're dealing with that and beginning to actually open up to the concept of such in a widespread, welcoming way. But when we talk about the incarcerated community, I mean, truth be told, it's one thing for me to isolate myself because I choose to. It's another thing when I'm here because of whatever action, and there is no choice of where I can go, which place I choose to isolate myself in. What's happening on the mental health side for our young people who have been impacted by COVID while being incarcerated?
Well, we don't use the word isolation in the jail, first of all, because for us, again, I can't speak of other environments, no one's isolated. It's like cell to cell to cell to cell. And some of the boys like to go on certain wings just to be together, to plan cahoot, take respite from the other one. So we don't use that word because it's really not, for us, it's not a fact. But we're there to check on them. As everything, I just took the vaccine. I got the vaccine on Wednesday, and that's something I shared with all of my boys every time they're in for a session, and explaining to them the pros and the cons out as I experienced it and the decision that I made to take it. And to be 100% honest, they were one of my main reasons that pushed me, because honestly, I wanted to wait and see if folks were growing horns or, you know, what was going to happen. I wasn't first in line, because I was not going to be first in line.
I understand.
But, I was not going to be first in line. But being frontline, we have to go and do it. And I did a lot of prayer. I talked to Dr. Mo, who will be on later on. I talked to lots of people who are in the field and helped me make a sound decision. And the boys, God forbid, I'm symptomatic or I'm positive and I don't know it, I would never want to get them sick unknowingly. I feel like staff are being super cautious. I mean, you have to fuss at them. Where's your mask? You know, I was talking to someone in my own office, and the lieutenant came in. He's like, "Where's your mask?" I'm like, "I'm in my own office. You get out." So we got to go back and forth. But making sure that they're kept safe. Some of the boys are very serious about it. They don't play themselves. If they're on, we call pods. So if they're all out in the group room, some will wear their mask, some won't, but that's not required because that is their home. Like that's their living room. So they are all together. But when they come off the units, they do have to put their mask on.
So let's talk about this vaccine. You are in the medical community and you took the vaccine. There are many, and I'll be honest, Forbes reported that there are doctors all around the country who are choosing not to take the vaccine. And that's creating quite a stir, no matter what community, from barbershop to beauty salon, in our churches and in other areas. There's some pretty real conversation about the vaccine, why they don't want to take it. Obviously, we all are aware of the Tuskegee experiments. Even just recently, Penn is having a conversation, which we'll talk about later on in this broadcast, around doctors who utilize the incarcerated community for testing of viruses and disease. So there is a reasonable fear that exists within our community. Why did you take the vaccine? I get it. It was for the children, but do you believe that the vaccine was safe? I mean, where was your comfort level? Was it as a professional courtesy, or personally, you truly believed that this vaccine was going to do what it needed to do?
It was a combo. I mean, obviously, I want myself to be okay. I have a 16-year-old son. I want him to be okay. And I'm the one who's in and out of the house now because we're back inside the jail every day. We were working from home before. But it really came down to having multiple conversations. And even in terms of mental health, talking with the boys about what's happening. One came in today and he was like, oh, I already heard someone who took the vaccine got corona. And I have them saying row too. So they say they got that work. And we went right on Google and I'm like, there's no cases reported. You know, I joke with them. If you don't see me next week, I grew my horns. Like we make it, you know, not light of it, but just to make sure their anxiety isn't going up. But I talked to multiple MDs, African-Americans. One of my close friends, a Howard alum, is an epidemiologist, Dr. Kina Gooden, and she, you know, works in the field, not directly on coronavirus, but she just put me at ease in terms of this is not the virus being injected into you. This, you know, yes, it was rapidly done, but that's because they put the money into it to make it happen faster because there was a need to happen faster. And if you think about it, the people who are creating the vaccine, they need to take it too. So we're going to assume they're not going to create something that's going to grow their horns or knock them out or take them out also. So I think the rapid pace that it was developed is what scares a lot of people. And as you said, in African-American community, then we have this historical foundation of the Tuskegee experiments and being injected with syphilis, and they had already gone over to parts of Africa and were testing on them. So being used as guinea pigs is also a true, real fear factor for us. And I took that into consideration also. But knowing that there's an African-American female MD who participated in the trials, that gave me some comfort. And also knowing there's no rhyme or reason to this. There are healthy people who contract the virus and there's unhealthy people. So you just don't know. If it was all unhealthy people, I probably would have been like, I can wait. Right. But it's not. I have family members who are recovering now. I have, you know, close friends who buried their mother. I've never been to a Skype funeral. I'm now attending Skype funerals. So you have to weigh all those factors in. What are you going to do? The conspiracy theories, we're being microchipped. Well, you and I can talk about your radio show right now, Heart City, and tomorrow it's up in my newsfeed. So I don't think they need a microchip right now in my shoulder to know all of my business. So I couldn't let those factors really influence me. It was prayer, research, not research. I have to say, I flipped on Facebook Wednesday morning and somebody was talking about the conspiracies. I'm like,
Facebook University has graduated so many PhDs.
There was somebody just going off. And I'm like, all right, let me bring myself back to peace. Understood. And ultimately, I decided not to wait. I could have. I mean, I would have preferred to wait a little bit longer. I'm not going to lie. But I'm frontline and I want to be protected as much as I want to protect those young men.
Listen, I appreciate your honesty on that. You know, there are those who are in the media who are being paraded around and their conversation is, I couldn't wait to take the, you know, vaccine. You know, let's be honest here, right? There's a little bit of trepidation there. There's a little bit of pensiveness that comes with this because all of this is new. We've been impacted. The world has been impacted by this thing. This is,
and I'm still in the cautious stage. Like it literally was Wednesday morning. You know, my arm was sore, my neck was achy, but you could get that with the flu shot as well. So I'm just, you know, paying attention to myself. And I ran outside with a jacket on yesterday, my pajamas to the mail. Now it's even this morning, and I'm like, I got the railroad. No, go outside in the winter in pajamas. With, you know,
what do you expect, right? I get it.
Pay attention. Yeah.
No, I appreciate that. And so, last question, or at least opportunity to have dialogue with the broadcast audience. If there was something that was on your heart around this issue, COVID-19. In prison and within our community, words of wisdom, advice, perspective that you needed us to know tonight to begin to digest and use it to make proper decisions around this issue, what would it be?
It would be to make sure you're doing your own research. in an educated way. Look up the forums that are serious about what's happening and how they're going about finding their information. Look at the CDC. Pray heavily. And also, even when information is coming out and within the prison system, you know, you have different avenues who express different things.
Yeah.
And if you're an advocate, I'm an advocate. This is my passion, what I do. But you also have a lot of advocates who are not inside the jail. They're not in the trenches. And then they're saying everything is torturous. And for us, that's not the case. You know, don't say they're getting psychotic because they're isolated because they tested positive, when I know for a fact that's not the case. Because one, we don't isolate, and two, mental health is there to check on anybody every single day if a request is made or mandatory or what have you. So there's a balance of hearing, you know, and it's a balance. So I would just say, make sure you're educating yourself. Talk to people whom you trust, but ultimately it's a decision you have to make for yourself where you work. If you're home every day, you're less likely to need the shot tomorrow.
Okay.
You know, if you know you're not going back to work for months and months, then you can wait in line and see how things are going. If you're back in an environment every day, and particularly if you're in the medical health services environment, then it's more of a need for you to take it. You don't want to be in the hospital because you just chose not to take it at all, or not to look at what's best for you and how you're moving about.
Understood. I honor you and I appreciate you for joining us today, Dr. Lockhart. It's important to really get to the heart of the issue and to hear the heart of those who are in the profession, not just the media spin. We really need to know the honest feeling, especially in this climate where facts are few and far between.
Yes. I just want to reiterate, like, I'm in the trenches, and those boys, I've been in prison. I've been in jail since 2001. So I've been doing a long bid also. And if I ever thought anyone, especially as a whole, was being mistreated, I would be the first one running my mouth. And my superintendent and assistant superintendents know this. Not to say there's not incidences that need to be addressed, and not to say, did someone slip by with a positive? Who knows? But I'm just saying, I'm in the trenches. So unless you're inside, you know, just fact check a little bit more.
So here we go. Quick question from the chat. Were you given an option for the Moderna or Pfizer vaccine?
We were not, but I think that's just because how it's been rolling out. What we were given was, there was a survey sent to us. Again, I work for Rutgers, University Correctional Healthcare, to see if we were interested so that they can make sure they order enough of the vaccines, they receive it. So to me, I feel like they were looking out for us in that respect. I personally wanted Moderna. I don't know if I have a full rhyme or reason. I just remember researching it before, and that's what stayed out in my head. So no, you're not given. And I think any site you're given whichever one they had. If they had Pfizer, if they had Moderna. Yeah.
Okay. I appreciate you answering that question as well. And we're going to make sure that we post information about your organization as well on our social media. Thanks again for sharing your wisdom with us today.
Everybody stay safe.
We will. So you've heard from Dr. Keli Lockhart about her experience in New Jersey, what's happening on the juvenile justice side. And it's really good to hear that New Jersey, quite frankly, is prepared for what's happening, at least in the facilities where Dr. Lockhart serves. They're making sure that they have adequate care and mental health professionals moving throughout the space to make sure that they are covered as well. I want to bring in two individuals as we talk about the advocacy side of this, because I think that's really important. Those of us who are on the outside, we need to know how to advocate for our loved ones who are in the space. Senator Anthony Williams and Reverend Michael Robinson, I want to bring them to the space. It's really important to have the both of you here. First off, welcome home again to you for coming to Heart City. This topic is real for us. We all know that there's someone in our community that's in lockup who's experiencing a pretty traumatic scenario right now, especially for those who are in adult lockup here in PA. And so I'll start with you, Senator. You're on the front line of this issue. You have actually, you just conducted a seminar and webinar yesterday around this topic. Many are frustrated about what they really assess to be a lack of response from Department of Corrections around this issue. As you see it, as a legislator and an advocate for the community, where do we stand? Is there proper PPE? Has Secretary Wetzel prepared the population for what's ahead in dealing with this pandemic?
You're dealing with a lot of things at the same time. You're dealing with a system that hasn't had new prisons built in generations. So there's limited responses that they can give. You do have 23-hour lockdown, which human beings are not intended to deal with, whether you are in prison or not. You do have adequate PPE at this point in time, but the question is, are the people who are watching the inmates using it properly? You do have from the top a protocol and a series of requirements that anybody would want to have. But the reality is, with an antiquated system, with limited funding, with not using reprieve in the manner that most of us would suggest the governor use it, and that the secretary is allowed to use it, there is a lot of frustration and fear. I will say that on balance, Pennsylvania is frankly a little bit better than most states relative to how it's affected the population, but nonetheless, the nation has to face the reality that we are way behind in terms of healthcare in delivering, not just in the pandemic, but after we come out of the pandemic, for inmates. And the population of significantly Black and brown people of modest income. And this has nothing to do with whether they committed a crime or not, whether they are guilty of paying their price. This has to do with the basis of the foundation of democracy, and that is we're a humane society, and we're supposed to take care of the least of us as well as the richest of us, and certainly inmates qualify in that space. And so the hearing that you referred to, and Malik, I'm always impressed with how much you keep up with stuff that's going on, was well attended by obviously a lot of advocates, many of them frustrated and angry. They took it out on Secretary Wetzel. And some of it, was appropriate on the issue of reprieve. And for those who don't know what reprieve is, the governor has the opportunity to allow for prisoners to come home during this period of time, through that period of time. Now they have to go back because their time is not served. But for those who are concerned about reducing the prison population, that's one avenue. The other avenue, which many of us are aware, is the General Assembly can have laws in place that would have allowed that to occur effectively. But Democrats don't control the House and the Senate in Harrisburg, and Republicans just didn't entertain it. And so our hands are tied to a very limited ways and abilities to reduce the population. And some of them are just not comfortable, 23-hour lockups, and a variety of other things we've heard about. Right. So it is a mixed bag at best, if you will, and certainly one that's fraught with a lot of anger, frustration, and concern.
I understand it. Reverend Michael Robinson, you are not only a leader in the workforce development space within the city and the region, but you're also a senior pastor. And so you're dealing with this on a couple of different fronts, not just professional, but dealing with families who are impacted by the very things that the senator just spoke of. As it relates to advocacy, our religious institutions, where do we need to be on this topic? It is clear we are impacted by it. It's clear that there's work that needs to be done. What are our steps to progress?
So we know from the first of all, thank you, Brother Boyd, for inviting me, and
thank you.
It's good to see you, Senator. How you doing, sir? One of the things we need to do is to contact folks like the senator. We need to reach out to our legislative leadership and let them know what some of these issues are. We know that 1 in 5 state and federal prisoners in the United States tested positive with coronavirus. We know that because of social distancing challenges, that they don't have that luxury. And because they don't have the luxury of social distancing, it makes, the incarceration of those individuals at the municipal level, at the state level, and at the federal level, it makes those situations super spreader conditions for the coronavirus because they don't have the luxury of social distancing.
Yeah.
Then we also know that it's an issue for those that are guarding these individuals, for the correction officers at the municipal, at the state, and at the federal level, because they're impacted too. We know that, there have been at least 275,000 prisoners that have been infected and over 1,700 that have died. And those are minimal numbers. Those are minimal numbers. And then we look at, the infection rate of staff, those numbers swell a little bit higher. So these are the things that we need to allow our representatives, like our state reps, our state senators, our congressmen, our U.S. senators, because these are the legislators at the state and federal level that can legislate, create policies, and look into these issues to make systemic changes. Because, let's keep it real. For the most part, these incarcerated individuals at the municipal, state, and federal level, they're on lockdown with a pandemic that they can't escape, that we have the luxury of social distancing from. They do not. And then when you couple the mental impact of the stress that impacts the body, my master's degree is in counseling, and we take stress for granted. But when you think about a person who's incarcerated, the doctor mentioned and Brother Chester mentioned a moment ago that because of the pandemic, most of these individuals are locked down for the most part of their day and only allowed out to eat and to shower for minimal, like a couple of hours or an hour a day, out of a whole day. And when you think of being locked down like that in a confined super spreader environment for COVID-19, the stress of that, knowing that you don't have distancing opportunity, where you don't have adequate support to prevent the spread, because prisoners have a higher incident rate of COVID than the general population. It's significantly higher. The stress of that, when you have extreme stress, you got cortisol, over amounts of cortisol, adrenaline, and this other chemical cocktail that releases in the brain called norepinephrine. And when you have an overabundance of this chemical cocktail that your brain produces, it impacts the body negatively. And those chemical cocktails are created from overstressed, an overstressed body. So yeah, we need to advocate to people like, the senators and other legislators to let them know about this problem.
So Senator, I know there's legislation like Senate Bill 942, which PA Senator Sharif Street has introduced. Obviously, this bill deals with those who are lifers over the age of 55. Obviously, their rate of recidivism is drastically low due to age and occurrence, and moving them off of the rolls and the cost of incarceration so that we can allocate those funds to more effective ways. Hearing what Pastor Robinson talked about in terms of the stress level, the mental health scenarios, has there been conversation on the legislative floor about the mental health scenario inside of our correctional facilities?
Well, I want to assure everybody, Reverend, thank you for your comments and perspectives. Because if you're Black and you have a pulse in you in America, I don't care if you have a little bit of money or jingling in your pocket. You understand the conditions under which we're living. And you can't escape the reality of that the majority of us have somebody who's in a prison someplace. That's just the reality. And so you've heard the stories. And if you're serving in the General Assembly or in Congress or in City Council and you're Black, the first thing is you're getting calls, you're getting letters, you're getting texts, you're getting tweets every single day from somebody you may know personally, a family member, a friend, a constituent. So all of that certainly has been carried by members of who are in the General Assembly going forward. So I mean, and understand that the Reverend did a great job of explaining the stress level for the person who's in the prison, but it goes through the entire family. So it goes to his children or her children or at home. Your spouse, whoever that is at home, is interacting with your mother, your father, whoever it is. So that's the first condition. But yes, we've all talked about Senate Bill 14, which is with technical violations. People are still locked up because they can't meet bail. All these things are part of what we're talking about reforming. And some of these things are moving. Senate Bill 14, which was the technical violation bill, which I got out of the Senate, the House has not moved yet, new session. Shreve Street bill, we talked about, Lifer. All those things are certainly talked about, and some Republicans are even involved in that. But the reality is, this pandemic can't wait for that bill, even if we have people of goodwill to move forward. We have to do something different. And I'm not a fan of the reprieve process, but I do think that calling us is wonderful. But frankly, I think at this point in time, Enon is one of the biggest churches in the region. I would hope that, not just Reverend Weiler, but the, parishioners there write the governor saying, we understand you're not a fan of reprieve, but we need to use it because we got to get people home. I would hope that every faith-based entity that has this information would do that. I would hope that every legislator and every constituent, everybody who's listening tonight understands what that word means and call the governor. Because at the end of the day, we know about it, we talk about it, but I'm tired of talking about it. We got to do something about it, right?
Yeah.
And we're not going to build new prisons. Those bills won't move fast enough. The only thing we can do is get people out of harm's way. And that is, and obviously, we designed it, and I think it was intended to affect about 1,500 folks. It's only affected 200 people thus far. Clearly, people, I don't know about you, but, I'm over 60, and Malik's, been with me when we golfed a little bit, right? Mm-hmm. He's hitting the ball like 390 yards.
In the woods, though.
Yeah. I ain't. Because I can't.
That's a show for another day.
My point is, somebody who's, that age, they're not going to be clocking. They're not a threat. Now, they may be annoying. They may be loud. They may smoke weed illegally. I don't know. But they're not going to be knocking anybody in the head when they go home. That is a significant portion of our population that can come home and, one, save money and also save lives at the same time. So my charge tonight was to make sure whatever place I speak that I talk about reprieve and that we need to talk to the governor about allowing us to use it in a lot more effective way than we currently do.
So Pastor Robinson, in hearing the call from the senator, look, it's not just enough to have the conversation with the elected, but we've got to put some pen to paper. We got to flood the email, start flooding the governor's office with phone calls. Quite frankly, the church has been the cornerstone of many battles, especially when we talk about communities of color. And so is this something that we can take up the charge within our churches, begin this conversation and spread it into our communities to ensure that we have one collective voice on this issue?
I think one of the ways we can do that collectively as a church, different clergy associations in the Philadelphia region, like the Philadelphia Baptist Association, which I'm a board member of. That's the oldest Baptist association in the country. Actually, it predates the founding of America. Yeah. I'm a board member. We need the Black Clergy of Philadelphia and other alliances like that to maybe come together and combine with the mega churches like Pastor Waller over at, Enon, and smaller churches like mine, Greater Enon Missionary Baptist Church, and all of those that are in between, to sign a petition to show the clout and strength of our collective coming together to say that we want reprieve. We know in Philadelphia, and as of April, March, up to now, we have seen, like just in Philadelphia, 17% in the drop of the jail population because of low-level offenders being released to kind of relieve the pressure and the stress of the spread of COVID. We see in Bucks County and North Cumberland County, they've reduced their jail population by 30% as of April 16th. California Superior Court judge ordered the Orange County jail population cut by half. And in Detroit, Michigan area, sentencing judges ordered the release of 384 people from jail. And then we see, as of March 18th through April 15th in Washington, D.C., their jail population decreased by about 22%. So reprieve is important and it's working, but we, according to the senator, and I agree with him, we need to do more of that. And with low-level offense, like if somebody's in jail, because you got folks that went to jail that are serving years right now in prison for smoking weed or for holding the nickel back. I'm sorry, see, I'm showing my past.
Listen, it's good. This is a community show. They understand what you said.
Well, first of all, Pastor, you showing your age. They don't got no nickel bags, bro. I don't know what you're talking about. I don't know nothing about no nickel bags.
You said, oh, by the way, I'm not a part of that.
That's why I love Senator Wood. I love this. But see, that's a subject for another day. I'm incensed that you got folks serving years for, carrying small amounts of weed, and folks like that. I mean, come on, let's release those kind of folks to relieve the jail cell pressure, because it also serves another issue where we want to reduce the swelling population of our jails, because that's an issue. Because when you look at the overall expense that we're spending to incarcerate folks, you could put somebody through Ivy League education, the money we spend per person to incarcerate and warehouse them in jail. So, I mean, we need to rethink how we're doing this. So I agree with Senator Williams in the reprieve issue, because we see it's working around the country, even locally. We just need to do a better job of it.
So broadcast audience, you're hearing from PA State Senator Anthony Williams. He's making it very clear. Look, yes, you can call. We're aware of the issue. We're already on the floor dealing with the issue. And no, we're not saying that your call is not welcome, but a more effective way for us to resonate throughout the chambers and halls of legislation is to begin to have conversation with the governor's office, make those calls, put the letter campaign together to ensure that we're talking about reprieve and other effective ways to get our loved ones out of harm's way. It's not going to be enough to send more PPE into an already challenging space. Okay, there are other ways to deal with this, and we need to come together. Okay, so for those who swore that we were Voltron coming together in November for presidential elections, this is yet another issue by which we can come unified to make sure that the medical care of our loved ones are in place. For Pastor Robinson, he made it clear, look, there are organizations within the religious community that are ready to go. They're beyond fired up and ready to go. They just need you. So come with the pen and pad together. Bring your uncle and them and your cousins and your aunties, everybody that can write and sign petitions, bring those together so that we can begin to have those conversations. Also, as passionate as Pastor Robinson was, he was absolutely correct. We've got to be clear on understanding the cost of incarcerating individuals who we could be doing better things with, especially Senate Bill 942 and others, and SB, I believe, 14. 14, Senator,
about 14. Yeah.
And so when we talk about legislation that can really get the job done to ensure that those who can be more effective on the other side of the wall get there so that we can have finances to address these issues, these are the bills that we need to know about, talk about, and more importantly, act on. Now, Senator, I have more.
Malik, can I jump in real quick? Because you hit on some really important points, but we got the time, and you're talking about the prison population, even beyond the pandemic, there was, I don't know exactly what the number was, $40 million in what they call CARES Act money. So for those who don't know, the money that the federal government, not this round, but the last round, sent a lot of money, millions of dollars, to the state of Pennsylvania. And we spent that in different pockets. We didn't spend all of it in the timelines that were required, so they took a significant portion and sent it to the prisons. I would suggest to you that, I can't say, I spent a lot of time in prisons when I was a teenager and a kid. My dad was a lawyer, a defense attorney, so spending Saturday with my father was, doing some of what I wanted to do, but a lot of what he had to do. Right. And so I learned a lot about the population. And so that 70s had a significant educational component, preparation, and you mentioned PhDs. There were people coming out of prisons during that period of time who were prepared to face life differently because they had a skill set.
Yes.
If we have that much money driven, we should redesign what we're doing with time spent in prison. If you're going to spend 23 hours in a cell, you better make sure that people have technology so they can decide that I want to get a different skill set. So when I leave, one, I'm literate, because the prison population, a significant portion of it is not literate. They learn for the first time how to read because they're in prison. We need to meet them where they are so they can get prepared that when they leave, those who have some level of momentum, and that's frankly the majority of them don't want to come back, that we give them a skill set that goes more than just when they see me in a grocery store and they come home, yo, Mr. Tony, yo, can you get me a job? And they don't know anything about that process. We need to get them prepared for where life is. That's a lot of money, $40 million. I don't know what the number was. Significant amount of money that we can use in this system. The other part is we built one prison.
Yeah.
In the last 20 years. Now, I'm not advocating going out and building prisons to build prisons. What I'm suggesting is reducing the population, but where you actually have a population that supports it, you should at least update it so that you can meet crisis when it occurs.
Agree.
Safety, health, education should all be a part of a blueprint in terms of when we're spending money in these facilities, which frankly would do a lot about what we're concerned about going forward. So I would hope we would use the time to understand what we're talking about. And that is where you call people like me. That is where you write letters to legislators and say, look, if you're going to do a budget, you need to spend the money this way this year, because we do a budget every year. And that is exactly where we need to be doing those things. And the last thing I want to say is, Pastor, I would hope that what frustrates me is when I end up talking to like many of the pastors, it tends to be during an election cycle. And even my friends who are pastors say, Tony, I love you, I'll elect you, but they don't necessarily know what I do in between. And, there's a lot of things that go on that they can be a part of. And I will tell you, other communities do that. So communities beyond our community, they write all the time to their legislators because they're following what's going on. I would love for not just the Black clergy of Philadelphia, which frankly is largely a political entity. I mean, the clergy in general, the faith leaders in general, to have us at least quarterly, if not twice a year, federal, state, and local, come and report. This is what's going on. This is where we need help. How can we help you? So that we can translate more information. Because I feel very that we're not doing it.
Can you and I work on that? I love that idea, and I would love to work with you on that, because I think with you, your name is a marquee name in politics. So working with you, I think, will generate other political leaders. And then on my end, I can pull together the clergy. But I love that idea.
Happy to do it.
Listen, I love solutions. That's what Heart City is about. My two big brothers and mentors just showed us how to get it done.
I'm going to tell you an inside secret. I'm going to cut him off. So he's one of my hangout buddies. He's one of my young boys. He's one of my young boys. I got more hair than he does. But that's it. So we do play golf. I want y'all to know that. And it's a poor man's sport and a middle income man's sport. So, So he rides around. I don't really ride with Malik that much. So I used to ride with him more, but now I'll tell him why. Because if I'm in the cart, he starts talking about work. Like this couple coming in, they're like, yeah, I just got to do that. Or, Black people are oppressed in Southwest Philadelphia. Yeah. I'm like, dude, I don't know, but all I know is I shake the ball. That's what I'm focused on right now. We focus on, like, save the world on the golf course.
Look. I mean, while
he's a wonderful man.
I'm trying to figure out not how to 3-putt and for the world not to go, down the whole island. So it's a joint effort. But I tell you, I honor and appreciate both of you. Yes, this segment ran a little bit long. There's something to be said, broadcast audience, about a talk show host, a pastor, and a politician getting together. That's what happens when we get together. It's just what it is. All right, I apologize in advance. Nonetheless, what the senator brought to the table, for those who asked in the chat, what bills are we referring to? Senate Bill 942, Senate Bill 14. We're going to make sure that whether it be Senator Williams' office or Hart City, that we get that information to you about these bills so you understand what's before us and where the opportunities are. You already heard Pastor Mike Robinson is going to lead the charge along with Senator Williams to begin to combine the church and elected community to make sure that we're having some quarterly check-ins. That's the point by which you can show up, right, and make sure that clergy who represent you in the center chair, not just in the kingdom, but in the community, are able to reflect the issues that matter to you on the windows of the elected. Pastor Robinson, I honor you and appreciate you, brother. Same with you, Senator Williams. Thank you for coming in tonight and giving us such great information and wisdom.
Bless you, man. Bless you both.
Bless you. So I want to bring in really quickly, we have Dr. Monique Gary and Farrah Morgan. We're going to bring in both of these esteemed medical professionals shortly after this interview, because we promised you that we would have conversation around the vaccine. We would talk, quite frankly, about your fears, your trepidations, but more importantly, what the facts are, so that we can get some of the stereotype and myth out of our community, but we get some real impact. Before them, I want to bring in the founder of Synergy Reform, Doug Reed. This brother is on the ground in a tremendous way, not just in the community with organizations like Black Men Heal dealing with mental health, but Synergy Reform is making sure that when we talk about recidivism efforts, when we talk about rehabilitation, we have a true resource that we're making sure that even in the midst of reprieve, and if Senate Bill 942 moves forward and we're bringing individuals home, that they have the resources to be effective, especially in a time where we're dealing with COVID. We don't just want to move people out of a medical condition to place them in an economic hardship. We want to make sure that there is true resource all around. For those who are now just joining us or have joined us recently, I want to make sure that you understand this was brought about. This topic was brought about dealing with COVID-19 in prison. We are highlighting an animated video that was brought to us by the Pennsylvania Institutional Law Project. Sue Ming and her organization put together a compelling video to talk about the issues that are happening within the incarcerated community for our loved ones. And so this issue, as you now know, is on the legislative floor. It's also in the conversations with our community leaders, but also know that we're all working together to get this job done. Doug Reed represents the community. He also represents the correctional officer community as well. He has a myriad of experience as it relates to this topic. Doug, it's a pleasure having you with us today, man.
Yeah, hey, once again, Malik, I thank you for actually inviting me. This is my area. I worked 25 years in the federal system, actually the largest federal prison, which is in Fort Dix, New Jersey. So I understand this topic. I understand this topic around the inadequate medical care concerning the inmates. I understand the topic as far as, what it is to be a staff member working under those kind of conditions and what it takes. But you have a lot of disparity even with that, just to make the comment, because, some COs are wearing masks, some are not. I just got notification today that some of the federal officers at Fort Dix are getting ready or actually prepared to receive the vaccine, or they got notice from Washington, D.C. So, things are being done, but even there, and it's actually public that, Fort Dix is actually going through a second phase of increased numbers of COVID-19 with inmates. So it's definitely affecting the population across the United States. And, you know, even when I came in 1992 at the height of the crack law, where actually with 3.3 million inmates, particularly at that time. Now we're down to only 1 million. And that's been over 25 years that this has actually occurred. So one of the things I listened to I watched the video and I listened to Su Ming, and they talked about the importance of communication that we got to have. And that's on both sides to understand the importance of this particular issue and what we need to do as a whole, as a collaborative effort. And that's what synergy reform is based on inmates that were formerly incarcerated, staff that retired out of the system, and a collaborative effort to actually educate the public as far as what's going on. So I thank you for just inviting me just to share my thoughts for this broadcast.
No, it's great to have your perspective. And so PAILP obviously put out an amazing animated video to talk about this issue. Chester Hollman brought in the perspective of the inmate. Here's what we're facing and dealing with. Here's some of our issues, our fears around the topic. Here are some of our needs. I mean, when you hear, you know, a throwaway surgical mask, 2 of them being given to an inmate and the individual being told to wash it out. Now, I know, because I had those before we upgraded to the cloth masks, right? Those kind of masks, any kind of water or moisture on those masks, and they begin to deteriorate. It's not an easy task to be able to wash it out, keep it clean. And obviously, if I am talking throughout the day with the mask on and I'm unable to wash it out and I put it on the very next day, I'm literally recontaminating myself, right, you know, at this point. So he dealt with the inmate side, those who are incarcerated. You see it also from the correctional officer side, from those who are serving inside in the professional space. Talk about the fears there. Those who are serving the community in that capacity, what are they up against? What are their fears right now around COVID-19? What can we do through, you know, PAILP and synergy reform to support a whole addressing of this medical issue and pandemic that we face?
I mean, you know, the major concern is the fact that it's the population. There are so many individuals in a confined space. You know, like I said, I worked in the largest federal prison in the United States of America, but throughout this country, you know, mass incarceration is a part of that. We have to reduce those numbers of mass incarceration. I mean, we even went back to, you know, talking about the nickel bag, but the thing is, we have so many individuals, especially individuals of color, that are incarcerated. So they're concerned with being in those confined areas and catching the COVID-19, whether somebody is being accountable or wearing a mask, or whether, you know, the COVID-19 is starting to spread because buses that are coming in, or, you know, the likelihood of, you know, inmates being transferred during this particular time at a height of a pandemic. So they have those fears. And then they have those fears that once they leave there, if they contracted the virus or whatever, that they're taking it back to their families, which is a major concern. I had a guy that I know that he actually made a Facebook post, and what happened with his baby tested positive, but because of him being in that type of environment and how he felt. And of course, you know, we talk about Black Men Heal and what I do for that. Just, you know, the awareness and the stigma, you know, we talk about you know, being in solitary confinement, and that's what's actually going on in a lot of these places where the numbers are large. You know, these inmates are actually being, you know, being in their cells almost 24/7. You got, you know, staff that are accountable for them, but they don't know. As far as, you know, even with their medical records, you really don't have the access to whether somebody has tested positive within those confines, because some things, only thing we can do is protect ourselves with the mask, or, you know, what's been issued to us. And there has been of course, there was, you know, in the beginning, there weren't enough masks that were actually available. You know, people donated masks. Now the numbers are increasing, but will they be adequate for this time period that we're actually experiencing right now?
So is there a fear around the vaccine with those who are serving in our correctional institutions?
Yeah, you know, I think it is. And guys that I talked to, and the young lady, the doctor, stated that because of how fast it happened in getting that vaccine together. They're not confident in what it can do. But of course, being in an environment, we ain't been talking about. We talk about COVID-19, but we talk about hepatitis C and all those other things. That's a series of shots just to stay in that preventive measure. But these guys, or men and women, are not. A lot of them are not confident in what that vaccine is actually doing. My wife works in the medical field, and she took it. And of course, the first shot I'm hearing is, of course, the soreness. The second shot, I hear there's a little more soreness, but that varies for individuals. But there has to be a confidence level as far as us seeing the numbers, and we won't see their numbers probably for maybe years or next year or whatever. But I don't think the numbers as far as how effective that it will be is actually out there, and have enough confidence for these guys to actually do it.
I think that's really important. When I started working with the CDC to begin to start pulling some of these numbers and figuring out where we were, understanding that this particular vaccine, they almost quadrupled the amount of participants in the early stages to ensure that they were able to get a quicker time frame, right? No money became a roadblock. No amount of money became a roadblock in order to move this forward. And probably for maybe our lifetimes, definitely, we saw pharmaceutical companies not necessarily in competition per se, but charged around one particular goal. Obviously, Pfizer and Moderna want to see who could be quickest to market. Nonetheless, this was for a worldwide approach and application. And so I think some of these facts matter, but obviously for communities of color, we've been impacted for years around these stories, these real life stories of our community being used as, test market.
Yeah,
for all kinds of things, not just Tuskegee, but even right here in PA in our penal system. And so it's interesting to hear that same trepidation exists within the correctional officers as well who serve. And so it seems like there's a unified fear within our communities who are dealing with the correctional space. What does a correctional officer need from the community who's listening right now? How do we support the families of those who are going in on a daily basis? How do we let those who know and work there on a daily basis that we support them, that we're behind them, that we want to see them medically cared for and prepared to deal with this pandemic? How do we begin to communicate this message and work together?
Yeah, I think one of their things is, of course, being a line staff and working as a correction officer. A lot of it goes back to communication. That especially in these type of environments, their voices need to be heard. The issues that they have need to be taken seriously. One thing that I did when COVID started, I actually went up to Fort Dix with other retirees, and we just was out there in the rain, just letting them know that we appreciate the job that they do.
Wow.
That means a lot to them. The fact that we're like that low class law enforcement officer because we work in a prison. But I think even their voices being heard and the ability to just to be appreciated for what they do in that type of environment, because they are law enforcement officers. And it takes a lot to deal with that. They are the mental health advocates per se, if you want to say that. They are the ones that have to listen to the conditions of individuals. They are the ones that see death when it comes in that kind of environment or dealing with riots. So their voices just need to be heard. So, when you see them or the job that they do, the most important thing is just tell them that they appreciate it. Just like we tell our individuals of the armed forces and everything, we tell these correctional officers, we appreciate the job that they do based on the conditions. And I think there's even laws trying to be passed, or there's legislation to say these are hazardous conditions that they're working under.
Indeed.
So things like that, and push for those types of things when you hear it, as far as legislation and letters, and based on the condition, or these being short of staff working in these environments. How do we get additional people hired to make sure we are at our numbers to take care of the population? So I think it's just a matter of their voices to be heard, and we continue to support them.
Doug, a question from our broadcast audience. Are correctional officers mandated currently right now that you may know of to be tested for COVID-19?
Well, I know what's actually going on, and they said it before, like when they go in, they're getting the temperature tests. Mm-hmm. So they're not mandated, but I think, I would say I would get back to you, because I like to get back to you with facts. That I would find out. One thing I do, as far as you talk about mandation, I know these guys are working 12-hour shifts, but I think it's just the temperature test that actually is going on right now.
Doug, as we close this interview, from your heart to the broadcast audience, you represent the perspective of those who serve in law enforcement in various capacities. And so from your heart to the broadcast audience, what is it that you need for us to hear, for us to know, and to receive?
I mean, during this particular time, and where we are, even like my thing is mass incarceration. I came in into the federal system at the height of the crack law, and we had numerous amount of individuals that were being incarcerated. So I think we really need to take a stand in regards to mass incarceration and trying to reduce those numbers, as far as especially people of color, and some of these disparities with the crime laws and criminal justice. So just support what's going on in regards to criminal reform, and write to your legislators.
We heard from Senator Anthony Williams exactly what we should be writing and to whom, and so you're spot on with that. Dr. Keli Lockhart jumped in to support you in that question. She said in New Jersey they are mandated.
Yeah, and I think that's maybe for the state, but like I said, I worked on the federal level. I don't think that the feds are mandated at all.
And Su Ming Ye just supported you on the PA side. Teamwork, I love every part of it. So the executive director of the PA-ILP said, look, in PA, it is not mandated. The federal BOP also is not mandating it for staff testing. So I think that's important for everyone to know. And so if you are concerned about your loved ones who are putting on the uniform and serving in that capacity, making sure that they have adequate PPE and testing and all of those things, this is the conversation that we need to have with our community leaders, lead it right up into our electeds, and support PA-ILP and great organizations like Synergy Reform. Doug, we honor you and appreciate you, man, for the work that you're doing in this space.
I appreciate it, brother. Thanks for having me, and I look forward to working with you down the line.
Looking forward to it. Looking forward. And so you've heard from Doug Reed, who represents the law enforcement community, helping us to understand not just the community angle, but also what's happening with our correctional officers on a daily basis. You also heard feedback from Su Ming Ye, Executive Director for PA-ILP, in reference to what's happening on the PA side in terms of mandatory testing for staff members. But then also you heard from Dr. Keli Lockhart on what's happening in New Jersey as well. It is mandatory for those who are serving as staff. Now, we promised that you would be able to ask your questions around the vaccine. There's much in the wind as it relates to the vaccines, Pfizer, Moderna, whether or not it's carrying live virus or not, and all of these questions. And so nor the team here at Heart City are medical professionals, so we want to make sure that we brought on medical professionals who could answer the clarion call. I'm going to bring two to the table. These individuals are absolutely phenomenal. Dr. Monique Gary, right in the middle, is a board-certified, fellowship-trained breast surgical oncologist and medical doctor right over at Grandview Health, right in Sellersville, PA, an amazing individual in the space. And To the right of the screen, Dr. Farah Morgan, MD. She's the Associate Professor of Medicine and Program Director for Endocrine Fellowship at Cooper University Hospital. It is a pleasure to have both of you with us today. Thank you so much for spending time.
Sure. Thanks for having us.
Yep. Thank you so much.
So there are many of us confused. I'm just going to be straight up. I'm just going to be honest about it. Okay. So I got the email, the Community of Color Foundation, wherever they may be, whoever those board members are, send us out an email. We are not sure about this vaccine. Okay. Some believe that the vaccine has live virus in it, and I'm going to catch COVID-19 if I take any one of these currently approved vaccines. In addition to that, you know, it was too quick as far as they were concerned. You know, and ironically, there was a president who pushed for it that some may have had issue with him. And so anything that he put a stamp of approval on also potentially created a area of challenge. And if that was not enough, this truthful history, painful one, of communities of color being used for testing purposes, unbeknownst to them, even as late as the 70s, when we talk about Pennsylvania and the Delaware Valley, you combine all of that together, and Lord knows nobody wants to take a thing. And so both of you are esteemed professionals in the field, and I'm honored to have you with us tonight to talk about what's real and what's not, and your professional advice around the COVID-19 issue medically. So, Dr. Farah, is the vaccine made by the boogeyman and another setup to take out populations, you know, by the masses? Is that the case?
So the vaccine is not a live virus. It does work differently than previous vaccine technology. It kind of teaches our cells to make antibodies against this virus. It was fast. Part of the reason why it was fast is because they were able to manufacture vaccine at the same time that they were doing these experiments. And as much mistrust as we may have of our current leadership, I don't think he had an actual role in the trials or the FDA approval of the vaccine. So what I tell I would never tell my patients that something was safe that I wasn't willing to do myself. So I had my second dose of I had the Pfizer vaccine last night. So, really minimal issue, just like you said earlier, a little bit of soreness after the first dose, a little more flu-like, type symptoms after the second dose. That just tells me, I think, that it's working.
So as a medical professional, did you have any fear or trepidation about taking the vaccine, considering that we all are acknowledging that it was a quick development time period?
Sure. I think there's always, a little bit of hesitance for something that's new. But I think, the way I look at it is, what's my small risk of a long-term side effect from this vaccine versus really great risk from having COVID and long-term side effects from COVID. So I think you really have to weigh those, risks versus benefits. And I didn't have any contraindications to the vaccine. I've never had a vaccine allergy or an allergy to the component, which is one of the biggest issues. And so, I think the numbers of COVID we're seeing, the young, healthy people that we're seeing sick, even though, yes, we see greater risk in the elderly population and people with pre-existing conditions, but there are definitely those surprises.
Yeah.
And, nurses are exhausted, our ICU doctors are exhausted. And I think the only way, we're going to get out of this is with a safe, effective vaccine.
So, Dr. Gary, you nodded your head like it was a great Sunday sermon that Dr. Farah was giving us about this issue. I'm sure some of the same sentiments around what we're experiencing with COVID-19. What's your assessment of the overall landscape and the vaccines?
So the overall landscape, I think, looks dismal when we look at what's happening in states like California, where the healthcare systems, the hospitals are overrun. Texas, another state where we are experiencing such significant burdens on the health system. And it's worrisome. And I think that it should really be encouraging to all of us if we can do our part to reduce the severity of this virus. Because let's be honest, that really is the goal of this vaccine, just like the flu vaccine, is to reduce the severity. We're not saying you won't get the coronavirus, and it should be noted that there are many types of coronaviruses. But by recognizing this one, it should hopefully reduce the chances of contracture, but also then of the severity of hospitalizations, the multi-organ system failures that we're seeing, and hopefully keep people out of the hospital. So I think that there's a lot of opportunity for us, and it is encouraging. And to the point of the vaccine being developed so quickly, it is built on the years of research around mRNA vaccines. So this technology itself is not particularly new. This is the first time we have deployed it at this massive level, but we've been working on this for some time now. And so while it would seem to have evolved quickly, I liken it when I talk to patients, to the singer who's been writing songs for an awful long time and singing backup, and now they just finally put their album out. Everybody says, "Oh, great, they're they're overnight success." Yeah. They've been doing this for 20 years.
Exactly.
This science has been around for some time. The other thing that I talk to patients about is looking at the data itself, because it is now available, and we can see that Black and brown people have participated in the clinical trials. 10 to 20%. Blacks, has Hispanic, Latinx population, which is more than the cancer clinical trials right now. I'm a cancer doctor. Right. And I see patients every single day who are terrified of trials. They don't want to be experimented on. They have all of the weight and the gravity of what has happened to us historically. Mm-hmm. And they don't feel well. They are sick and they're tired and sick and tired of being sick and tired. And so they don't participate in clinical trials for cancer. But we can see that these numbers are really impressive when you look at the amount of time that they did these trials for Pfizer and also for Moderna to get 10%, 20% enrollment in Black patients is noteworthy.
And I think that's really crucial to note, because I think many did not believe that people of color volunteered for this process. I know actually a few who volunteered for the clinicals personally. And so it is warming to know that not only they participated, but the numbers by which we participated, I think are equally as important. When you talk about mRNA vaccines, I think that's really crucial. And if possible, can both of you begin to break down the mRNA process? Because many believe that this vaccine is carrying the most lethal dose of COVID known to man, and it's only going to take one bad cup of orange juice to activate it and go through your whole world. Can we talk about really what this vaccine truly is, so that people understand why it had to be refrigerated and transported this way, to kind of dispel some of these myths in the space? Dr. Farrar, I don't know if you want to take that and start.
Sure. I am not going to pretend to be an immunologist or an infectious disease expert. Yeah. But the way the mRNA works is, and part of the reason why this technology has been worked on for a long time is previously it would get degraded very easily. Yeah. And that's why they couldn't actually get it to work in a vaccine. And so with these vaccines, they've been able to prevent that degradation in order to get it into the cells, make this spike protein that your body then reacts to and builds antibodies to. So like I said, it's basically, like teaching your muscle cells where it gets injected to make antibodies against the virus. So it's not virus at all that's being injected into you. There's no way that you could get COVID from the vaccine.
So
I got 2 words for that. Community will understand this, and I will be dating myself and showing my age. Gordon Gartrell.
Wow. No, you didn't. Just bring it in.
Gordon Gartrell.
Gordon Gartrell. Right?
So what we're talking about, the mRNA presents the pattern, the Gordon-Gartrell pattern to the cells, to the body, and says, hey, make this yellow shirt with the satin and the black cuffs and the, and the big collar, right? So then the cells take and they make the shirt. And every time you see that shirt thereafter, I want you to get rid of that shirt. It takes it and teaches our bodies how to recognize it, replicate it, and then put it on and say, okay, now wear the shirt. And every time you see that shirt, I want you to get rid of it.
And so any variation of it.
And any derivation of it.
So no matter how many times Theo tried to create that shirt, we're gonna toss it and put it in the trash. Exactly. And so I think that's really important, because so many believe that, you know, this is just a shipment of COVID being sent out around the country. And I think it's really important to hear from doctors who are in the space, who understand, medical professionals who understand what's truly happening. And so when we talk about the vaccine and COVID-19 in prison, understanding we have an incarcerated population who doesn't have the same level of mobility that we have, do we believe in any way, shape, or form that the vaccine and the application of the vaccine in incarcerated environments could actually be fruitful in reducing these cases? Dr. Farah?
Yeah, absolutely. Anyone, any population that would be at high risk would be the population that should receive the vaccine. Prison population, including the prison guard population, anyone that works in the prison should receive the vaccine, because it can reduce, again, what we know is that we reduce the risk of at least severe infection. Okay. Don't know that we reduce transmissibility. So we still have to wear that PPE, and it's not going to be 100% of our population that decides to get vaccinated. There's going to be some people with contraindications and some people that make a decision not to get vaccinated right away. So it doesn't make the PPE go away, but it dramatically will reduce our numbers of COVID and hopefully the spreading in the community and in a prison population.
So I want to bring up a few articles that have impacted the community. These are ones that have either been supplied to us or what we've seen on the AP Wire that has made the rounds and created some of the community conversation. This one here, healthy doctor died 2 weeks after getting a COVID vaccine. Most believe, quite frankly, that, once you get the vaccine, you're good to go. Such is not the case. I talked to individuals at the CDC that said, look, even in a vaccine application, if 10 million people get the vaccine, we expect a certain amount to deal with complications. We expect a certain amount of transitions, individuals passing away. And it is not always tied directly to the vaccine. There are other complications that can exist. Do you agree? I don't want to say believe, but do you agree with the CDC and their position on that? Because I think it's important to hear from doctors who are working within our community and hear your perspective on some of these things, rather than just black and white and websites telling us these pieces of information. Dr. Monique?
Yeah, I'll take that one. And I do. I think there's a lot of confounders in this article also, because when you read it, you don't get a sense of, one, what this physician's COVID status was, and whether or not that physician was actually tested or tested positive for the coronavirus. Two, it would appear that he maybe only got the first dose of the vaccine. And so having not received the second dose, then had only a partial immune response anyway. But what we know is that, for the more than 5 million people who have been vaccinated so far, less than 5,000 adverse events. I think something like 175 cases out of the 5 million were reviewed for severe allergic type reactions. And then of those people, 21 cases of severe allergic reaction, 80% of those had previous severe allergic reactions to something else or to another vaccine. So
Wow.
the majority of people who are responding in that severe way have had severe reactions in the past. But again, it continues to be the minority. So seeing this and watching what happened to this doctor, his platelets began to drop. He began to have elements of a platelet dysfunction leading almost to a surgery and died of a stroke. One could wonder if he had what we call a microvascular disease already, or if he had contracted the coronavirus previously and was in a pre-symptomatic phase. So there's a lot of unanswered questions there. And I think the title can be misleading, and it can lead people to think, see, that we're giving people the coronavirus, but we are not giving the virus within the vaccine. It just doesn't happen that way. And so I think we have to be really careful not to extrapolate that from this article.
Dr. Morgan, did you want to chime in or high five Dr. Gary on?
I want to high five her. I definitely agree. I think, you really can't determine causation at this point. And if we give enough vaccine, there are also going to be some coincidences that happen. People are going to get sick, and that illness is going to happen to occur around the vaccine. So I don't think that we can conclude that that was causative to the vaccine at this point.
I think that's great to hear, and I'm hoping that the broadcast audience understands where you're going with it. Here's another interesting article. And So Healthline reports that a new study found that 80% of COVID-19 patients were vitamin D deficient. Pretty interesting. Now I know I stopped milk a long time ago, and I don't. My Centrum vitamin may have a little bit of vitamin D in it, but I had too much Captain Crunch growing up, so I was like, as soon as I can just do sausage and fruit for breakfast, I was going with my milk consumption or vitamin D. Talk about vitamin D in communities, especially communities of color. This report, as with many, I believe is probably a moving target, because we're getting new information every day. Some of the stuff we talked about in April is no longer kind of relevant to what's happening right now. And so as it stands with vitamin D, are you finding in the space, Dr. Gary, that vitamin D may potentially play a role, or some other deficiencies playing a role as to why we are contracting COVID-19?
I think it does. I don't know that this study highlights it for our community. This study was done in Spain. They looked at 200 and something patients, and so 80% of those patients. But what we do know are that Blacks here in America historically have had low vitamin D levels, and it's associated with higher rates of hypertension, higher rates of cardiovascular disease. I actually, Dr. Farah probably can run them off better than I can. But the interesting part of this for me highlights the fact that racism continues to be a public health issue, and that even the test that we use to detect vitamin D, test for a protein, a binding protein that many Blacks don't make. And so you find that we're vitamin D deficient, but we don't have decreased bone density. We have no osteoporosis. We don't have a lot of the stigmata of vitamin D deficiency. And so even in how these tests were developed and the studies that we're finding, I think we have to make sure that we interpret them, one, through a lens of cultural awareness, but also look to find ways to fortify our vitamins and our immune systems through our nutrition, because that is what so many people want. And so, you mentioned you don't drink milk, and, nobody's getting as much sun as we would like to get these days. Let's be honest.
This is true.
There's some other ways that we can build and fortify our vitamin D levels. And I think focusing on our antioxidant intake and making sure that we are providing our bodies the things that it needs to fight infections and to decrease inflammation have all been shown to be really helpful in fighting the coronavirus.
Dr. Morgan, it sounds like we need to have a lifestyle conversation within our communities about, what we're ingesting and how we're actually receiving it. Things like vitamin D. What are we doing? Especially in a pandemic where we're all inside, significantly, unlike what we would normally have done throughout these summers. And so what are your thoughts around this particular study and this article?
So first of all, a very large portion of the population is vitamin D deficient.
Okay.
Most of the vitamin D we get is actually from sunlight. Very little of it is from food. And in the Black population, there's actually a question of whether the normal range should be different.
Okay.
Because just like Dr. Monique said, there's not osteoporosis, there's not elevation in parathyroid hormone with those lower vitamin D levels. So, maybe the cutoff should be 20 instead of a cutoff of 30, which is what we use for the general population. But we use one normal range. There is an increased risk of vitamin D deficiency in obese individuals.
Okay.
And so if we look at that study, it's one of those things, because it's a retrospective study, it's a little hard to decide on causation. So, they saw that there was, the patients that were vitamin D deficient had more severe COVID, but they also had hypertension. They also had diabetes. So is it the hypertension, the diabetes, and they're sicker, so they got less sunlight, or is it truly the vitamin D? Now, is there harm in taking vitamin D? If there's potential, we need to do those studies. Some prospective studies need to be done where they, maybe give vitamin D and then look at, do people do better if their vitamin D is repeated?
Mm-hmm.
If people are concerned about vitamin D, it's reasonable to take a supplement. What I would caution people about is not overdoing it with a supplement. Okay. So vitamin D is what we call a fat soluble vitamin. So it stays in your body for a long time. If you have a high calcium level for one reason or another, sarcoidosis, you shouldn't take high doses of vitamin D because you could make calcium levels worse. So I usually tell people around 2,000 units of vitamin D. If you take that over the counter, you're very unlikely for it to be too much. It will replete most people to normal, maybe not our obese population because they may require higher doses.
Mm-hmm.
If you start getting into 5,000, 10,000 units, you can make your calcium high. Those doses are too high, but you can find them easily over the counter at the health food store. So Don't think the higher, the better.
Don't think the higher the better. That's really good to hear. And then also, you're probably talking to half of the male population when I say this, but, popping 3 multivitamins a day is not necessarily going to help you get down the road to preventing contracting the COVID-19 virus. And so it's good to hear those facts presented. If I could, and I know time has run long, but I want to kind of break down some of the myth of COVID-19, some of the things that we've heard from submitted conversation from our audience. So, the healing power of the human soul states that there are no such things as diseases. And so COVID-19 could not possibly be what they say it is. Now, Dr. Gary, I saw your face going to all kinds.
I'm having trouble with my poker face over here, man. I had 5 cancer surgeries just today, and I can tell you disease is very, very real. And it happens over time. It does not happen overnight. And this is why wellness is not a destination. It's a journey, right? And to the person who is thinking that, I think they want to maybe change their thinking a little bit to begin to look at what prevention looks like over the course of a lifetime, because the cellular mistakes that lead to chronic diseases don't happen immediately. What we're seeing, some of the really deleterious and awful effects of the coronavirus are in many people due to pre-existing conditions of inflammation, of chronic fatigue, of hyperglycemia and poor glucose management, insulin resistance. All of these things are stressors on the body. And you guys, your barbershop talk earlier, the Reverend was hitting on it, right? The Senator, you guys were getting into it. And I love that dialogue, because we start to talk about what happens to our bodies as a result of stress. And disease is a result of all of those processes. And so it very much is real.
Wow. I really appreciate your factoids about that issue. Dr. Farah, here's one for the ages. Natural prevention is so much better than artificial inventions. And so there's no need to deal with vaccines and the like. What are your thoughts and your response to that?
So, I mean, obviously masks work, right? Masks and social distancing work. Those are natural things that we can do to prevent COVID. But I think if we want to be able to take our masks off at some point in the next, I don't know, year or two, I think a vaccine is really what we need in order to do that. Obviously, we've seen in the last year that COVID is not going anywhere with the things that we are doing. And, some of that is that, maybe not everybody is socially distancing and masking the way that we should. But a lot of it is very innocent. It's people visiting a family member and thinking, it's my family. I don't need to wear a mask around my family. And that's where they're getting COVID. That's a lot of what we're seeing right now is families transmitting it to each other. So I would say the vaccine is what we can do to protect ourselves, our loved ones. For me, I feel like it protects my patients. And, I unfortunately, there's nothing natural that we know of, vitamin C or, even though vitamin D may have an association, that's not going to be enough, unfortunately, to protect you from contracting COVID.
It's funny that you said that, Dr. Farah, because in the comments, Darnell Jackson said, let me grab my vitamin D pills before my wife kills me. Laugh out loud. Well, Darnell, vitamin D won't be enough, according to Dr. Farah, in terms of dealing with the COVID-19. So here's another one. Dr. Gary, we know they are all systematically hiding the real data because we never see the real data. It's a conspiracy.
Ooh, sometimes it is. And even as a healthcare professional, it has been. And I think we have to acknowledge this really sordid relationship, right, between the medical community and the medical establishment and our community. I mean, we were doing eugenics experiments on inmates and incarcerated people from 1900s to 1970s even, right? One of the articles that you guys sent to me looked at this dermatologist from Penn who for almost 25 years was experimenting on people in a really unfortunate way that disenfranchised people in our community. And so that distrust and that conspiracy factor is not unwarranted. I say that it is not our community that doesn't trust healthcare professionals or the medical establishment. It's that we haven't earned the trust of these communities. We need to do more of these conversations and bridge these gaps. But along with that, I think that there has been transparency. You can go to the FDA and the CDC website, and you too can read this data for yourself. You can see the videos that feature Dr. Kizzmekia Corbett, who is one of the scientists who helped to discover and invent and champion this vaccine. So to that person, I say, when we are not at the table, we may be on the menu, but we are at the table this time. And so that means we have representation and advocacy. And I think that if we do the same things we've always done, we're going to get the same things we've always gotten, which is the very least and worst of everything. And so this is a real opportunity to maybe step up and look at it in a different light.
Wow. Dr. Farah, this one comes from within our incarcerated community. They said, look, mRNA vaccines changed the human genome. And as a result, impacts adversely the body itself. Now, we just talked about the synthetic nature of the vaccine, but can you touch on this myth around the COVID-19 vaccine?
Yeah, so mRNA is RNA, not DNA. So, our genome is DNA. And the RNA is actually degraded pretty quickly. So it doesn't affect our DNA in any way. So
don't take my word for it. I'm like LeVar Burton right now. There are medical professionals who are letting us know the truth. Here are the last two. Look, those dying of COVID-19, Dr. Gary, would have died of other causes anyway. So why take the vaccine?
Well, to that I say I'm going to a funeral tomorrow of someone who probably would not have died of something other than this virus and the effects that it has had on the body. And so I think that it'll be many years before we really tease out all of the reasons why people died from the coronavirus, but it is an attack on the entire body, the entire system, starting with the lungs and the pulmonary system and all the small blood vessels and the brain and the heart. And I mean, there are so many insults and injury due to inflammation inflicted by this virus that I think it is easy for people to say, look, they had XYZ or they had a stroke, but what was the precipitating factor that caused that? And it likely was the virus. And so I think when we look at causation, it is multifactorial. It'll be many, many years before we really tease out all of the data because we've never experienced anything like this in our lifetime. But that this virus is wreaking havoc on young people, on children, on perfectly healthy individuals, and those who live are experiencing really long-term side effects as well, cardiomyopathies and heart issues, lung issues. You know, healthy athletes are having heart trouble and can't play athletics anymore at the collegiate level, and their professional careers might be ruined. So there is something to it, and I think we can't dismiss it.
So, Dr. Farah, the last myth of the day, COVID-19 is a hoax. None of this is real. It's all being manufactured through the media.
So, I had the experience of walking through the ICU the last time that I was rounding in the hospital, doing endocrine consults. And it is surreal, really, to, watch these patients prone on their belly, on the ventilator, patients on ECMO, young patients. We have a very large ICU at Cooper. It is very, very real. And horrible to watch. It's horrible to hear my patients' stories when they lose a loved one. It is very, very real.
60 seconds, Dr. Morgan, from your heart to the broadcast audience. What do you need us to know, understand, to digest and make a part of our moves as it relates to COVID-19?
So I'd say, just as Dr. Gary said, it's there is definitely a problem with trust in the medical community. And a big part of that problem is that we haven't worked hard enough to regain that trust. And I do think that's where we are right now and why we're struggling. We, unfortunately, minority populations are affected the most with COVID. That's where we're seeing the deaths and the disease. And that's the population that really needs to get vaccinated so that we can protect that population. So I think we need to do a better job at transparency and, things like you're doing tonight to, get rid of those myths around the vaccine. I think, we need to do a better job really as a country. I think in wearing our masks and protecting each other. I think that's really what this is with COVID. I think this should bring us together as a country rather than separate us like it has. It really should be that we're trying to protect each other to get through this. We all want, our family to come out healthy. We want to, have a real Christmas next year with our family, real holidays, whatever you celebrate, and I don't want to see any more of my patients die from this disease.
Wow. I honor both of you for sharing this time. I know, this is the weekend, right? You're supposed to be detoxing from the week, but it's such an amazing thing to hear from such esteemed professionals in the space and kind of get the real facts on the table to the community. Dr. Gary, you have the last word. From your heart to the broadcast audience, what do you need us to know, ingest, and apply as it relates to COVID-19?
I think as it relates to COVID-19 and health in general, one, it is completely appropriate and okay to ask questions. to challenge, to critically look at the information that is available, and not assume that what you read on Facebook or anywhere else is gospel and is news. You know, we can think critically for ourselves. We are a free and self-determining people. I think it's important to always remember vulnerable populations. You know, I have family members who are incarcerated and a nephew who's a correctional officer. And we, in our haste to get folks what they need, we cannot overlook things like informed consent and the rights of these individuals. We have to protect them at all costs because they have historically been the most vulnerable population, but we also must protect them. And the last thing is that this is a chance for us to step up. You know, we continue to experience the worst morbidity and mortality in nearly every single disease state, cancer included. And this is an opportunity for us to begin to start to reverse some of that and take back some of our power. And so I view this, and I view this vaccine, the trials, as an opportunity for us to be on the forefront of what happens to us and in us and for our communities. And I think that we should start to change the way we look at our involvement in medicine and take back some of our power.
Take back some of our power. We started that journey tonight with the two of you. Thank you, Dr. Gary and Dr. Morgan, for sharing this time with us and giving us your wisdom and expertise on this issue.
Thank you for having me.
So you have heard from Dr. Monique Gary and Dr. Farah Morgan. They literally gave us the facts, right? So when we talk about a vaccine carrying a disease across the Americas, that is not the case. When we talk about COVID-19 being a hoax, that is not the case. When we talk about a potential systematic way to wipe out communities, well, Dr. Monique Gary made it clear, look, there is an history here between the medical community and communities of color, but it's all the more reason why. You need to have the facts, you need to be able to access the numbers, and we need to talk to professionals, those who are doing this on a daily basis, who represent our communities within the medical space. We need to hear from them on a consistent basis, and to both doctors' points, ask questions. Nothing is off the table when we're talking about our health and, more importantly, our lives. The show, we started talking about COVID-19 in prison, and it was so important that we started there because many members of our community are dealing with challenges in the adult population. How we support them, how we advocate for them, how we create legislative change, all of that was discussed tonight. Ming talked about the PAILP's animated video, its purpose, its storyline. You heard from Chester Hollman III, who helped to narrate that storyline. They gave you the inside baseball and what's happening inside of our prison system. It's so important that you not only watch this video, and we're going to make sure that it's on our social media pages. Please share this video all weekend long, all next week. It's so important that we talk about what's happening within the walls of our prison system. You also heard from Doug Reed, who brought up the fact that correctional officers are fearing some of the same issues. This is a unified effort when we're talking about healing and providing resource within the four walls. No side is safe. And so we need to make sure that not just PPE, but whether we're writing for reprieve for individuals like Senator Anthony Williams talked about, and letter campaigns through our churches and community leaders like Reverend Mike Robinson discussed, whether we're dealing with Senate Bill 942, getting lifers who are past the age of 55 and less likely to re-enter the system. We need to get them out into society so that we can take care of them medically, but then also make sure that resources are allocated for those who are still in. Senate Bill 14 doing the same for those that are within the space. All of that comes together to create a solution to deal with COVID-19 in prison. There are virtual calls that can happen to members of the incarcerated community, but your call needs to be to the governor, per Senator Anthony Williams, have a conversation around reprieve, making sure that the governor understands that this is an issue that must be dealt with just like we are dealing with COVID-19 on the outside. You also heard from Dr. Lockhart. Dr. Keli Lockhart broke down what's happening in the New Jersey side as it relates to our juvenile justice system, what's happening there, some of the precautions that are being taken, preventative measures that are already in place, and what can be best practices across the board. And so just like there's a bridge that brings New Jersey and PA together, surely there is also a bridge of resource and expertise that can also happen and be brought to bear as it relates to what's happening in PA. Some of those best practices in New Jersey, we need to talk to our friends and family in New Jersey who are in the community and know what we can replicate right here in Pennsylvania to make sure that adults do not have 23 hours of lockdown just in order to save themselves from catching COVID-19. It is unconscionable that that environment even exists at this point. And so you also heard from Dr. Monique Gary and Dr. Farah Morgan, who broke down, all of the nonsense around the vaccine. And so when you talk to Uncle Ray Ray and you talk to, Aunt June and Big Pop and you talk to your brothers on the corner and you talk to the guys in the barbershop and those in the beauty salon and those in the churches who are saying, look, I know about Tuskegee and I'm not going for this. Let them know the facts. Share this video on your social media pages, not for our promotion, but for the promotion of the facts and the experts who joined us tonight. If we share the facts, we empower ourselves to be able to make the right decisions to take care of ourselves and each other. This video will be reposted on our social media channel. Thank you so much for sharing your Friday night with us. For those who have incarcerated community members inside, let them know that we love them and that we are here ready to talk about solutions, not just the issue, and that there are those in the community that truly have a heart, not just for the city, but for everyone in it. I love you. Have a beautiful weekend. Thank you again for watching.
COVID-19 has impacted all of us, but people who are incarcerated are experiencing a dramatic change in their living conditions and safety during this pandemic. Prisons and jails are hotspots of COVID-19 in the United States. The fact is, if you're living in prison during this pandemic, you're at a higher risk of getting COVID-19. Life in prison is group living. You have meals and recreation together and share common areas. You are unable to socially distance on your housing block or in your cell, or you may live in an open dorm. Staying 6 feet apart is often impossible. Dozens of people enter and leave prison every day, increasing the chance that you will come in contact with someone who has been exposed.
One of my major concerns is being in the day room. The day room is just a room with bars in it. There's no windows, there's no doors to protect us from people that are coming into the prison. If someone walks into this prison with COVID-19, they will have to walk past us. And if they were to cough or sneeze or anything like that, they would literally be affecting this whole entire room.